I'm here with Epidemiologist Bonny Specker from South Dakota State University, who is going to be providing us with a mini lesson today about health system capacity thresholds, and also give us an update on everything that's been happening with COVID-19 over the last week in our area, in the state, nationally, and in the world. So Bonny, what do you have for us today?
Yes, I'm going to talk, as Chelsea said, about the health system capacity. The World Health Organization uses three criteria for considering whether or not public health and social measures um, should be considered when adjusting for COVID. The first one's epidemiology, the second one's health system capacity, which I'll talk about today, and the third one is public health surveillance. And Brookings makes use of one indicator in each of these three criteria for their thresholds that are done each week. One of the 7 criteria for the health system capacity is that data are available to evaluate whether or not a health system can absorb or expand to cope with at least a 20% increase in COVID cases. And this would indicate that the system would be sustainable even if there's a surge in cases. And one thing is, how do you determine what that potential caseload is? This is just a graph of the Brookings cases as of yesterday, October 18th. And there were two things that we thought we could look at. One of them is the total number of cases in the previous 7 days, and then also the number of active cases. And we've just started including that active case because when you have such a big increase like you do right here, you can actually have a lot more active cases than you do total number of cases in the previous 7 days. And you should consider that when coming up with these thresholds. So we estimate the number of hospitalizations in 2 different ways. We take the number of cases, both the previous week and the active cases. We do it for both of those numbers. And we can multiply them either times the overall state hospitalization rate, which we have for October 15th, which was 6.4%, or we can come up with some state age-specific hospitalization rates. And I just want to show people how we do that. This is a common thing to do in epidemiology to adjust for looking at things that might be very strongly associated with age. On October 15th, the overall state hospitalization rate was 6.4%, and there were 202 cases in the past 7 days as of October 16th. So if we multiply those 202 by 6.4% or 0.064, we come up with 13. So that's an expected number of hospitalizations based on the number of cases in the past 7 days using the overall hospitalization rate. If we calculate it based on the active cases, which was 261 on October 16th, we come up with an estimated cases or hospitalizations of 17. But hospitalization rates vary significantly by age, and this is one of the graphs that's in the daily update. But you can see here that if you have COVID and you're 80 plus years of age, 29.5% of those individuals will be hospitalized. But down here, if you're 30 to 39 years of age, only 3% of the cases are going to be hospitalized. And this is South Dakota data. So these are estimates of hospitalization rates based on what we know to date. Now, if we look at the age distribution of recent cases, that also varies. So this is the age distribution of the Brookings County cases between October 2nd and October 14th. That's the last group that we know what their age distribution was. That graph is also in the daily report. But you can see that 28.8% of Brookings population, or of their cases, were between 20 and 29 years of age. Now here I'm just showing the last 3 age groups. You know, there's 8 different age groups. The table gets kind of complicated. But if I look at the age group here, 60 to 69, they represented 10.5% of the cases between October 2nd and October 14th. If I multiply that 10.5% by the number of cases that have been diagnosed in the past week, I come up with 21. Now, the age-specific hospitalization rate from that previous graph I showed you for this age group is 11.9%. So now I multiply 11.9% times 21, the number of cases, and this is how many expected hospitalizations are for that particular age group. So we do this for each of the 8 different age groups and then sum up this last column, and we come up with a total of 17 hospitalizations based on that age-adjusted rate. And then we do the exact same thing for the current number of active cases, which is 261 as of the 16th. So here we change this 202 to 261, and we recalculate that whole table. And there we come up with 22 anticipated hospitalizations in the next couple of weeks. So then we summarize all the different calculations we've done. These are the numbers based on the overall hospitalization rate. These are the numbers based on the age-adjusted hospitalization rates. And this row is the number of cases in the past 7 days. And this row is the number of active cases. And then these numbers in parentheses is that with the extra 20% added on that the WHO recommends. So you can kind of see that they're sort of in the same ballpark, you know, expecting 13 to 22 hospitalizations within the next couple of weeks. So we do this table, the committee reviews it, we discuss it, then we provide this information to the health systems and let them determine whether or not their systems can cope with these additional numbers based on the current number of hospitalized patients and their census. Now, in the past, we've always answered this question: is the health system able to cope with the resurgence of COVID cases that may arise from adapting some measure? And we've always answered that yes, you know, they can survive. This past week was the first time we put yes, probably. And the health system felt that that probably was important. And the reason is the health of the providers is actually playing a role in that probably. You know, when they start getting sick, there's no one there to cover those hospital beds. So we really need to keep the healthcare workers healthy. And we're going to do that by following public health recommendations, you know, wearing a mask, socially distancing, practicing good hygiene. So it's really important that we do that so that we don't exceed that threshold on capacity. That's all on hospital capacity threshold.
Thank you, Bonnie. What do you have for an update for us for our COVID situation over the last week?
Well, it's been kind of up and down. Start out with Brookings. And again, all the graphs that I show here are in the daily report if you want to look at them closer. This week we've had 1,223 cases in Brookings. 226 of those were in the past week, compared to 151 last week. Right now, as of today, we have 333 active cases. That is a record high. We've had 30 individuals who have been hospitalized at some point. 11 new admissions this past week compared to 6 the week before. We have not had any more new deaths, which is good. We still are in substantial community spread, and in order to get down to that moderate spread, we need less than 34 cases in a week. We're at 226. We're way above the cutoff between moderate and substantial. The test positivity continues to be high. It's 36% using the number of individuals tested. The WHO recommends that that percent is less than 5%. South Dakota has had 33,836 cases, 4,911 new cases this past week, and 3,866 cases last week. There are 8,388 active cases. That's also a record high. 2,146 people have been hospitalized. 260 admissions this past week compared to 244 the week before. As of today, there are 304 individuals hospitalized with COVID in South Dakota, and that number is actually a record high. We did have 304 last week on one day as well. There have been 323 total deaths, 35 deaths this week, 40 last week, so that number went down a little bit. We actually are getting very close to the same number of deaths as all flu cases over the last 10 years combined. You know, that's probably going to happen within the next week, where we reach that sort of landmark. Test positivity for the state also is high. 37% of the people tested are positive. That really needs to get down below that 5%. This is a record high. And when you have that high test positivity, it's telling you that there's not enough testing being done, that there's a lot of infected people in the community that need to be identified so that we can stop this spread. The K-12 and higher education, these data just came out today. We have 2,044 K-12 students who have tested positive since the beginning of this school year. And we have 852 K-12 staff that have tested positive. Higher ed, 1,626 students have tested positive, and 127 staff members in higher ed have tested positive. If you look at the United States, we are increasing in cases. People think this is it looks like the third peak, not the second. There are 8.38 million cases, 395,000 this past week compared to 355,000 the week before. 224,730 total deaths. That's 5,035 deaths this week compared to 5,084 deaths last week. So it is pretty steady in terms of deaths. Worldwide, we have 40.26 million cases, 2.53 million new cases this week compared to 2.35 million the week before. 1.11 million deaths, 36,000 deaths this week compared to 39,000 last week. So deaths both nationally and worldwide look like they're coming down just a little bit. So that is good news. This website, I've given this every week, and this week is the first time that I notice it's not being updated daily. This is the list as of October 14th. I think that they are updating the travel restrictions a little less often than they were in the past, but hopefully this will help people. There's links to all the different states So you can go to this website and get to the state you're interested in and tell whether or not South Dakotans are quarantined from that. So for this week, protect others, wear a mask, socially distance, and get tested if you have symptoms or are a contact. We really need to get this under control before flu season starts.
And thank you, Bonnie. Those of you that watch every week, if you have a question for Bonnie regarding epidemiology, there is a link in the video comments that you can use to send an email, and we will answer those questions or get it on the topic of Epi 101 and talk about it for you. So ask those questions and Bonnie will get an answer for you. Thank you, Bonnie. I appreciate everything.
You're welcome. Thank you. Be safe.